I'm going to bring up on stage Garth Graham. He's Director and Global Head of Healthcare and Public Health at Google YouTube. So, Garth, thank you so much. We've already been talking you up a little bit. Hey, thank you so much. Well, I always got to find out whether there's going to be tension or are you guys going to like it. He might have said Google's just a waste of time. You never know. You never know. Meet Jonathan Epstein. So here we go. I'm having fun. I hope all of you are. It's kind of, so Garth, you heard what, I should also say, you're a cardiologist, you're a public health expert, you're at Google. And I guess, when I sort of felt avant-garde at the Aspen Health Summit, this was back when I was at the Atlantic magazine, having Google in the room with health people. Like we brought Google in the room. This is a decade ago, a long time ago. And I remember, being at your, I used this joke this morning, but it actually was true. It was with Larry Page and Sergey Brin and Eric Schmidt at a dinner years ago, and they said, maybe we can use technology someday to end death. And it was a big, big statement. It was at a dinner hosted at Eric's home, and a couple of the DC types in the room said, boy, that's going to be really bad for entitlements. But in the old days, Google was not thought of as a place, a platform that would be relevant to the health world.
Yeah.
And you saw it come in and actually become, very, very big, processing information, becoming big platforms.
Yeah.
Jonathan was just sharing, some of this as well. But maybe you can help give us a picture of what the state of play is today.
Sure.
And how embedded you are in the national health innovation picture.
Yeah. So, any of you, if you wake up and you have a runny nose and a blue toe, and a pink eye, what do? You look it up. And if you're sitting after having a complex conversation with your oncologist or something late at night and you want to know about an experience that other people have had with that disease process, you look for a video, you look for something to understand your experience. And I often say this is not a esoteric phenomenon. Everybody in this room does that. And so we're very much a big part of the healthcare system because we drive healthcare journeys. We drive the kinds of decisions that individuals make on a minute-by-minute, day-to-day basis. Most healthcare doesn't happen in hospitals. It doesn't happen in exam rooms. It doesn't happen necessarily on an OR table, although very good healthcare happens there. Happens before all of that. Before you get to these points and the day-to-day decisions you make about what you're going to eat, where you're going to go next, the decisions you make for your kids, all of those things. And so information has been a big driver of that. And Google is the #1 search engine in the world, followed by YouTube. YouTube is the biggest video library in the world, and everybody comes to us for all kinds of information about how to fix their fridge. And then cardiologists may look up about how to fix the RCA with a stent or surgery. So we're a big part of the healthcare ecosystem because of the context that information does in terms of driving health outcomes.
Is that system, it's, how do I ask this in a polite way? It's largely free, right?
It is free.
So it's free. How is that presence, that interaction with patient care? We were talking about taking tech from the labs to the patient care. Why hasn't your just blob, your blob out there, a big presence, decreased the cost of healthcare?
I think healthcare is complicated. I think there's nothing simplistic about healthcare in the United States or globally. And so the connection between cost and outcomes, I think, has been nebulous. I'm in DC, where everyone in DC understands that concept really, really well. But I think what we've done a really good job of over the years is really systematically improve information quality and the kinds of things that people are seeing and interacting with. And so we've seen this engagement on healthcare information grow year over year over year because people feel confident in information that they're getting. And so that's one role that we play in addition to some of the other roles around AI, as we were just talking about, and some of the other more intricate roles in the context of healthcare delivery. But one very kind of basic thing that we do is we help billions of people around the world every day make some important decision, whether it's a small decision about whether they should, eat peanuts versus candy, or something big about whether understanding BRCA genes or something even more complex.
You know, we've got Jonathan Epstein here. I would love to hear how, you sort of see the AI world and what you're doing in your platforms interacting with Jonathan and vice versa. You have a colleague named James Manyika I've known for years, so give him my regards. And James is like he's like the Yoda of this in Google land. But he starts out talking about advanced scientific achievement and innovation and how the tools that you're bringing to it are going to be embedded in it now forever, and it's changing the game. And I don't know, Jonathan, you feel that, but James is such a messianic force in that message. But is that happening?
Yeah, I mean, I think an earlier discussion was on some of the things that's happening with understanding protein structures. I mean, you've known this from your career. Going from protein to an actual clinical compound has a lot of steps that has taken many, many years. And now AI allows us to configure and understand those configurations. And those concepts dramatically improve pharmaceutical delivery, the kinds of things in terms of outcomes. So there's so many different aspects in which AI plays a real role in healthcare. And I think for us, one of the things I think that we've learned and done really well is do good in all of those areas. Work hard in terms of delivering information quality, work hard in terms of working with other leaders in the healthcare system, and then work hard on solving some of those concepts around basic science. That's particularly important.
Jonathan, what do you think about that interaction? Is it where it should be?
No, I think it's absolutely right. The only thing I would add, and I said it to the medical students at their graduation this year, is that all these natural language models are built on known information and known data. And what I said to them is, your job is to create new knowledge that the future models can be built on. And I do worry that if we only
don't get trapped in Google.
Well, it only knows what it knows.
Yeah.
And it has to have something to be trained on. And so if we believe that it is all powerful and has all the knowledge, we'll stop learning new knowledge. So we have to be careful to still empower people to create new knowledge and make new discoveries that can then be put back into these models.
One of the things I want to ask you both, and I don't know if other people have had this experience, but I share my personal stuff and tell people where I'm at. My mom died of breast cancer, but she was in there for a while. She lived in anybody from Bartlesville, Oklahoma? I'm always interested to find out if there's anybody. Paul DeBar, who's the Deputy Secretary of Commerce, is from Bartlesville, Oklahoma, and I found that out by asking in a room like, anybody else from Bartlesville? Anybody been to Bartlesville? No.
Okay.
Yeah? What, you have been? There's somebody where?
There's one.
Some people have been there.
Where? Oh, are you from Bartlesville? Okay, good. Well, that's good. Phillips 66 is from there. Frank Lloyd Wright's only skyscraper is there. It's kind of a cool place. But the healthcare system there, with all due respect to Bartlesville, kind of sucks in my view. And when I interviewed Sid Mukherjee about his book, and I read every word of that huge book on cancer, I realized that my mom had been subjected to things that already had been invalidated by science, because she was in a part of the country that was not yet literate, I would say, in that. So we moved her to Dallas, and some of the problems that she had were improved there. Then when I finally moved her out to the Eastern Shore of Maryland, we were close to Johns Hopkins, she got much better things. So I faced real world reality about my own ignorance, but also the unevenness of treatment, of care, of science around there. So one of the questions I want to ask you guys, because you were talking about translational science and getting this to patient care, is how big a lift, and can you solve the lift of literacy as achievements are happening so fast? How do you bring along the medical profession? How do you bring along the interface with the patient so that you're getting, whether you're in Bartlesville, Oklahoma, or you're Tuscaloosa, or wherever you may be, you're going to get some higher bar of engagement in American healthcare? You don't all have to live outside Johns Hopkins or Penn.
Let me challenge one of the premises that you
Go ahead.
in your statement. I think it is important to uplift certainly the healthcare providers, the healthcare ecosystem, but patients. We have to empower patients with information about their own care.
Yes.
Families with information about their own care. Caregivers, all of those things, because what you're finding nowadays is The idea that all the information and expertise in the world was locked away in the New England Journal or Nature Medicine or some of these places where we love to publish it, and that's where it is. That's not where it should be. It should be in conversations at the dinner table. It should be in walks that people have amongst their family and they're talking. It should be all these different places and in clinical rooms as well. And so the one thing I would say around the concept you just mentioned is we have to think through both how we empower clinical systems, providers to do well, but we also have to empower patients in terms of their own journeys and their families.
I think it's really important. I'm going to bring up in a minute a man I think is another hero in this story. I really respect Brad Wenstrup, a former member of Congress. He was co-chair of the Doctors Caucus. He's a war veteran and was treating people on the fields in Afghanistan. And he is out there. He's created Americans for Health Excellence about this. It's really about how to give patients agency in this process. But he's also basically saying, guess what? Even patients that get empowered and informed can still get screwed.
Yep.
And so it's in the ecosystem here of patients getting screwed, maybe insurance coverage, whatever. There's some really big gaps and problems. Is there any tilt that you can bring in? I always kind of look at it and said, you're either making your own weather or you're getting rained on. How can Google help change that equation?
Yeah, I think healthcare delivery is complicated. You know that very well. And in terms of simplifying these processes, it takes a number of steps. But I do think the capacity and the ability to simplify a lot of the back-end dynamics that happen with healthcare so that clinicians can do their work and become clinicians and not necessarily be engorged with paperwork, and administration is particularly important. So I think that part is good. I also think, the more we can create more transparency in the process, I think that helps both patients and the system. So I think a lot of what you see in terms of a lot of the partnerships that Google has had with healthcare systems has been around improving that ecosystem, some of the things you were alluding to before, so I think that's important. But healthcare requires so many different components of the players on the field to be all moving in the right direction. And so I think we don't necessarily want to simplify it, but understand kind of the various roles and responsibilities.
Jonathan, if you're going to ask them to fix one thing that they're not doing well, what would it be?
Well, let me just say, I think your comment about democratizing access to information is terribly important. We heard a lot of that when social media started and the internet was born, and everybody was like, it didn't always turn out so great in terms of misinformation.
Right.
And so I think we better make sure we do this right. And if we're going to give people access to powerful AI models, they better get it right when they provide that.
But what's frustrating me is I go up there.
That's what I would ask of Google.
I go up there and ask about healthcare things, and I get these damn lines, call your medical provider.
That's
call
the right
your doctor.
answer.
And I want them to just give me all the answers. And I don't want to call the doctor.
No, but that's
look at vaccines and the information that's out there about vaccination. You can find whatever you want to find, So we need to make sure somebody's vetting the information.
Well, just as we close this up, I'd like to hear from both of you, as you sort of in this bold bets frame that we brought to today, just be interested as you're kind of rolling the dice news. And I just want the country to know that Jonathan Epstein, we would be so screwed in our health and country if you didn't exist. So thank you for
not what my wife says.
Thank you for your lab. Thank you for all the innovations that you brought forward. You're an incredibly accomplished yet modest person, which I appreciate.
Thank you.
And Google, you're too big to ignore anymore. So it's like really big. So, but I'm just interested again, as we all are, if we're kind of put our resources and minds and thought together, in near term to give our audience and those that are going to be watching this, I think this is going to have a good echo and surround sound effect after this conference. What should be. What do you see coming down the road, or what would be the bold bet worth making that we need to get our heads around? Jonathan?
I think we should continue to bet on bold new ideas, on creating new knowledge, and not worried so much about how it's going to pay off in this quarter.
Right.
Create new, great knowledge, and we'll find great uses for it and innovative new therapies that will come from it.
Garth, same from you.
I think healthcare moves at the speed of trust. It's what the decisions that people make and the system that helps take care of them when they make those decisions. And so I think it's important that we empower patients. I think it's important that we understand the importance of high quality information, to the point you brought up, which is an excellent point. For us, we take information quality very seriously, and that's why we have credible sources and index on clinicians, et cetera. But I think the era of healthcare just being locked away in the silos of journals, textbooks, I don't think we're there anymore. And so the future is just more and more of this idea of how we empower patients on the journey and meet them where they are.
Great. Well, let's give a very, very big round of applause to Garth Graham, Director and Global Head of Healthcare and Public Health at Google YouTube.